Health website. Our online courses would be monitored and like their friends, peers, other friends and colleagues. So that Dr. Algaba also served as president of the Philippine Economic Society and the Civil Society Institute. He was also an Asia Research and Advocacy Advisor of the
Ibatana Ulbanid of Thailand, Dr. Nunik Kusumawardani from Indonesia, Dr. Dennis Butahan, Dr. Leslie Lopez, friends, colleagues. On behalf of the School of Social Sciences and the Institute of Philippine Culture, I'd like to welcome you all to the Ateneo de Manila University. And also welcome to this global classroom. This global classroom is where we will be maximizing the use of technologies to enhance learning. And I guess a similar undertaking is not result in cost efficient, good decision making, but also in the long run, client satisfaction, and of course, better health outcomes. HATID is more relevant now, especially because of the passage of the Universal Healthcare Law. Of course, HATID will only be effective if the right policy environment and good governance are in place at both the national and local levels. You know, I think Dr. Lopez will elaborate on this later in her presentation. Actually, HATID is one of my favorite projects here in the school because it showcases innovation in social protection, an area very close to me. I do a lot of research on social protection too. Dr. Batahan and his team is now in the process of disseminating this important technology by licensing agreements. So the first one, the first agreement will be signed on March 15 with the city of Cagayan de Oro, and the mayor, Mayor Oscar Moreno, will be the one signing for the city. This will be done PIC. Anyway, too much for my introduction. I think Dr. Lopez will give a more comprehensive presentation later of the findings of her study with regard to the implementation of HATID in Kapanatuan and Pangasinan. So welcome again to the Ateneo.
Thank you, Dina Lava. So, to represent our partners in Thailand, we will be hearing from a lecturer from the college obtaining his PhD in Social and Pharmacy Administration from the same university.
Is still working on related to the eHealth program. Thank you so much. Yeah, thank you so much.
Thank you, Dr. To represent our partners from Indonesia, we will be hearing from a speaker who received her doctorate from the South area in China. Since 2016, she has been appointed as the head of the subdivision of non-communicable diseases and mental health research at the Center for Public Health Research and Development at the National Institute of Health Research and Development in the Ministry of Health in the Republic of Indonesia. Please welcome Dr. Nudin Kusamawartan.
Hello, good morning.
Morning.
Yeah, sorry, the connection is not really that good here from Jakarta. Thank you so much for inviting me to this very productive and very good meeting. I think for the next plan for the eHealth in at least for the plan for the eHealth. For our countries, the digital technology is promising for future health system information to address issue in particularly in health issue uh, in the perspective of the information system and the communication in the healthcare system here in Indonesia. And yeah, Indonesia, we have many challenging issues in terms of the information system because we have a very huge geographical area and very huge population as well. And we have some area that still have low resources in terms of hardware, software, communication network, and also technology, as well as the human capacity. And this is a very challenging issue. And we always have problems, probably most of the time, in terms of the quality of the reporting system and also communication between patient and health professional. In some extent, it really needs further improvement here in Indonesia. And gaps also occur in terms of supply and demand on healthcare delivery that we probably know that it will lead to the lower health quality such as long waiting time, less quality communication between patient and health professional, and also lower treatment compliance. So the concept of e-health can be very useful and effective to address issue on gaps of healthcare delivery, as well as on the situation where we have a limited capacity and limited health infrastructure, especially if we have a very difficult geographical area or in a certain remote area. The e-health will be useful for health education method as well as part of the method to educate people and also the community. And that's why it will need further research, I think, to involve as well multidisciplines perspective, such as from the perspective of computer science, communication, and information system, as well as for the healthcare technology. And certain opportunities in research or pilot project of e-health implementation can be done in the following issue for Indonesia, such as the web-based surveillance, for particularly for NCD's risk factors. We do have developed this web-based surveillance since probably 5 years ago, but it's still it's under development, and then still we need to improve in the certain area for the web-based surveillance system. And we also have the Android-based system for child growth monitoring to prevent nutrition-related health issues such as stunting, undernourished, and probably also the obesity among children. And we have the program for maternal health. We call it Hello Midwife. It's an online health service for the maternal health, maternal and child health as well. And also we have developed the health facility database system. We have about like 10,000 government health facility in the village level across about 34 provinces in Indonesia. And we also have been developed the artificial intelligence for health services, for telemedicine as well. Sorry. And then the most recent one, we have the Android-based system for health services, and that we probably need to assess the effectiveness of this Android-based system of health services. So research and development on those specific I have mentioned above will be very useful for our government as well. Probably also can be as a lesson learned for other countries, such as probably we can learn from other countries as well, from Thailand and as well as from Philippines. I think it will be good collaboration in the future under HATID. It will be great, and then we can share knowledge and development between the Philippines, Thailand, and also for Indonesia. I think this is the end of my opening. I hope everyone will enjoy the meeting the rest of the day, and kindly apologize if I cannot participate for the whole meeting because I'm still in the middle of another meeting as well here in Jakarta. So thank you so much.
Thank you, Dr. Kusuma. So I would also like to acknowledge the presence of representatives from the ASEAN Secretariat who are also joining us online. So I hope you are all excited to learn more about the HATID ASEAN Project and the health information systems in the ASEAN. Our program today is as follows. So we will first be hearing more about the HATID ASEAN Project and other related eHealth efforts of the Institute of Philippine Culture. We will then hear a presentation of the project's methodology and initial findings. After this presentation, we will be having representatives from the province of Pangasinan react to this. We will then move to hear the reactions from our Thai and Indonesian partners. So we request that our audience members in the Google Classroom reserve their questions for the open forum part. For our online participants, our online moderators will be monitoring the comments section on the eHealth PH website, so please feel free to leave your questions here. These will be addressed during the open forum of the program as well. So to introduce the HATID ASEAN Project and other related eHealth systems, we will be hearing from the current project director of the eHealth tablet for informed decision making, which is an operational research project providing a cost-efficient and national government and more recently on the use of information and communications technology in health. Please welcome Dr. Dennis Patak.
Thank you very much, Trixie, for the generous introduction, and good morning to everyone, to our participants here in Ateneo de Manila University Global Classroom, to our colleagues in Chulalongkorn University in Thailand, and the National Institute for Health Development in Thailand and Indonesia, as well as we understand we have participants from Malaysia, US, and Vietnam, and probably from Vietnam University of Social Sciences in Hanoi, as well as from the ASEAN Secretariat in Jakarta. So what I'll be presenting this morning is actually the context for the implementation of the HATID ASEAN Project, of which some introduction has already been provided. So the project actually is a joint project between between the Philippine Council for Health Research and Development, ASEAN NDI, Ateneo de Manila University, and it was also part of the Philippine hosting of the ASEAN in 2017. So the context of the project is basically the ASEAN harmonization, of which we have 3 countries now participating in this project to enhance regional health integration. Within the context of the ASEAN, we need at least 3 countries to collaborate, hence the participation of Philippines, Thailand, and Indonesia in this particular project. We have actually been working on this project since 2016 and have presented this to the ASEAN Committee on Science and Technology, and the HATID ASEAN Project, and the next project will be described later, HATID ASEAN, is already part of the ASEAN Plan of Action on Science and Technology and Innovation, or APASTI, 2016 to 2025. So we're reporting regularly to the ASEAN Committee on Science and Technology, specifically as part of the APASTI. Previously, we had activities related to ASEAN starting in 2015. I'd like to thank our partners from Chulalongkorn University College of Public Health Sciences who hosted the first learning interaction on eHealth technologies in Bangkok in 2015. This was followed by Learning Interaction 2 during the ASEAN hosting of the Philippines in 2017, of which we had 2 events, one in Pangasinan and in Ateneo, the other one in Sofitel. There was a conference statement related to that. For learning international and to attend 2 of the international conferences in October 2019. This is part of the photos of the first eHealth technologies learning interaction, of which was hosted by Chulalongkorn University in 2015. And then this was part of the eHealth Learning Interaction 2, of which we had events here in Ateneo and also in ASEAN. So we're actually later, we will have feedback also from our Pangasinan partners. So we're actually HATID ASEAN Project, which has 2 main components, to strengthen selected components of the health management programs and eHealth service delivery systems, and to create a informal hub for eHealth practitioners such as this one. So actually we're now implementing both 2 of these. So this particular forum, which is actually live, face-to-face and online, is actually an informal hub that we have proposed to our partners. So specific objectives would be to assess capacity for health staff to implement eHealth systems, of which that part of the assessment will be very critical, very important to the ongoing transition to the universal healthcare implementation, and to develop the capacity of health staff to use eHealth systems to related projects for capacity building, and to optimize the use of selected ICT programs. The next objectives is more on the networking and collaboration, which is to establish working partnerships and relevant institutions in the ASEAN countries, of which we have the 2 partners already in place and probably 2 more from the ASEAN Member States, and to draft an initial governance framework on local health systems, of which Leslie will be discussing in more detail. So the study design is basically focused on local government unit. One is a province provincial level assessment, another one is a city level assessment. So Pangasinan is one of the biggest provinces in the country, with I think more than 1 million population. Cabanatuan City is a highly urbanized city in central Luzon, part of within the province of Nueva Ecija. These are also contiguous provinces in central Luzon. These are the criteria for the site selection, availability of the health programs management system, level of urbanization and socioeconomic development, and core willingness to participate in the project. The study population includes the Provincial Health Office of Pangasinan and 6 health facilities which were selected randomly, and in Cabanatuan as well, the City Health Office and 4 health facilities. So in our recent visits with them, some of the discussions were already moving into the framework of the universal healthcare. So, yeah.
Yeah, it's yeah. So random selection based on the criteria, and this were the based on the review of case of health solution from the US, and Finland. So we're finding out that there are a lot of technologies setting in, being introduced, coming from government and private sector. Because a lot of the technologies for health delivery now are technology driven, and we find that some of the hospitals are now using higher end ultrasound machines, which are offered to them directly from manufacturers from other parts of the globe. So even the marketing of these products now are done directly to these facilities. So data collection and tools and procedures, and the details of the study will be discussed by Leslie, including some of the preliminary findings. So this event that we're hosting now is one of the first events for the ASEAN partners, but we actually started already the data gathering around last quarter of 2018. So the convergence activities includes workshops and conferences such as this one, crafting of policies and regional framework on eHealth in the ASEAN. And I would like to inform the group that a new project related to ASEAN has been approved and supported by the ASEAN Secretariat in Jakarta, called HATID ASEAN on Health Information Infrastructure and Governance on Incident Technologies in the ASEAN, of which we will also have partners from the ASEAN countries, similar to HATID ASEAN. Briefly, I would just like to introduce some of the related projects that we are implementing. The HATID project has been briefly introduced by the Aldaba. We're now using the platform of eHealth.ph, which is actually a DOST PCRHD project that's being implemented also by the Ateneo de Manila University Institute of Philippine Culture. So we are sort of converging technologies now with the use of the eHealth PH, of which this is now being broadcasted through eHealth PH, with live streaming also being done with eHealth PH. We will have another online conference on April 25 on universal healthcare, which is the third of a series of online discussions on universal healthcare, which will be co-hosted with the UP Medical Alumni Society. We also have an ongoing project on training on unified resources online for Ituro, which is still ongoing, starting with data gathering being conducted, but we're also trying to collate the different online and eHealth related capacity building activities for our frontline health workers. So that's Ituro, which is we have a website as part of eHealth PH. Another related project is the MOOCs, or Massive Open Online Course, which is actually a project with the University of the Philippines and funded by the European Union. So the MOOCs are actually 20-minute standalone courses that you can take and have your certificate printed after you pass the quiz. So we have currently around 600 users of the MOOC, mostly from the province of Pangasinan. And we're encouraging other LGUs, RHUs, and even students to take the Massive Open Online course, since we're introducing that as well in the sector. Lastly, I would like to
imperative that they recognize or identify or determine firsthand whether the patient is still allowed, okay, to make field health plans or not anymore, because there's qualification and restrictions to do that. Although there is a recognition that it's easier with the consolidation of digitized data, let me reiterate that it is done only at the institutional level. Because the thing is, because of the variety of platforms that are being used by the different institutions, both public and private, sometimes it's difficult to consolidate across different institutions. That is why the role of governance and how to manage this different language, if I may use the term, okay, is very crucial. Cost efficiency, of course, you don't have to bring all the forms to the field health office, because they can actually submit the forms online now, although I think they're still required to submit the scanned version, and also it's faster in getting feedback whether they're qualified or it's a return to hospital kind of thing, or if there's, for example, problems with the submission, it's also faster for them to respond to this kind of problem. So less cost in terms of transportation and handling of the documents. Increase in transparency, because the information is there at the tip of the hospital administrator. I'm talking about private institutions. It's easier for hospital administrators, directors, or even physicians themselves who are attending to patients to make decisions based on available information. And when time is of the essence, okay, making decisions right away can be very costly, okay, meaning the inability. Next one is, okay, costly implementation. Partially, I already talked about this. In terms of the EMRs that are being provided by the DOH, it's provided for free. However, when we talk with the implementers, both at the local level and at the national level, there is the issue of technical implementation. Although they are able to encode some of the materials, maybe it's not in the right format, okay. And then there's the issue, for example, of consolidation. Because as we all know, when we're trying to implement change, there's going to be bugs, there's going to be kinks. The thing is, when the rural health unit would ask the DOH for additional support because they cannot figure their way out of these EMRs, there's very limited that is provided for. So for example, to be able to minimize, okay, the return to hospital thing, some units of the field are actually using their own facilities, their own manpower, just to be able to reimburse, okay, some health units were not able to submit on time because of the bugs and the kinks in the EMRs that they were using to begin with. Infrastructure, as we all experience, even in Ateneo, infrastructure in terms of internet is always a challenge. And we're already in Manila. So the thing is, this is not limited to cities. For example, there's a site that we visited, quite a few kilometers from the urban center, but you're familiar with the term dead spot, okay? So what they did is that instead of submitting everything in the hospital, they have to hire or they have to rent an additional office in the urban center just to be able to fulfill the requirement of field health so that they'll be able to submit all their data electronically. So if we wanted to achieve eHealth technology, it's the reality. We also need to provide supportive physical infrastructure. And this is not meant to do geographically isolated areas, because this thing can also happen a few kilometers from urban centers. And also in terms of servers, because as I mentioned a while back, some of the hospitals, in terms of cost cutting, insisted on using on their own servers. Meanwhile, public hospitals are serviced by servers assigned by field health. But because there are downtimes in the servers, sometimes it's difficult for them to manage the uploading process. And sometimes they would like the servers to, or those whoever are maintaining the servers, to give them a feedback
sooner than they usually getting now. Okay, one important findings that we're able to get on the ground is that when we ask, because the nuances, the context, and the conditions of the hospitals and the rural health units, although they are similar because we're talking about just one country, there are also nuances. Nuances in terms of physical infrastructure, nuances in terms of the profile of health service workers, nuances in terms of availability of technology in the hospital itself. But the thing is, they're all just following nationally mandated policies. And this has implication not only for the Philippines, but also for our other partner ASEAN countries to consider a more context, more geographic, local level implementation policies, because that will take into consideration the challenges, the limitations of the variety of health facilities that we have in the country. For now, it's fairly understandable because we're just starting with this process of change that it's all emanating from the national offices, but maybe in due time, we would like to see some more local context-specific policies with regard to the use, implementation, and management of eHealth technology. And then, okay, as I mentioned, when we shift into any form of system, it's short-sighted to say that there's no human resource component, because that's one of the most glaring findings that we have gotten on the field. There's always bound to be, and yeah, there is the component of age. Usually those are more quote unquote senior tend to be more resistant of the change. So whenever we're shifting into a new system such as this one, there has to be a huge training component. Not just training, but also everyday support, so that in case, because if they don't understand the system, it is something which is totally foreign to these health workers, the tendency is to just shut it off. But in case there's a support system that will be able to explain how are things working and how it should be managed, then what we found out is that they're more open, they're more accepting. We acknowledge also that there are different levels of learning, as we call learning curve. And therefore, we also have to take that into consideration. And then as for the conclusion, for sure and definitely, there's a lot of possibilities in terms of use of eHealth technology. But then this thing is only going to fly if we're able to address what are the emerging problems now. What are these? One is infrastructure. Second is the human resource component. Thirdly, definitely, is we have to have a more responsive policy environment. We already have some sort of a national policies governing on the use of eHealth, but some of them needs to be recalibrated to adjust to the situation that is happening on the ground. Also, we have to consider the additional cost. But sometimes, okay, as most government programs work, let's just implement and let's solve the problem as we go along. But the thing is, it becomes doubly difficult because you're not just implementing project or program, you're also kind of managing the problems as you go along. So we also have to consider the costs involved. Again, the soft infrastructure and the physical infrastructure need to go hand in hand. Okay? And the retooling specifically of health professionals. It doesn't have to be a big training, it has to be a more responsive kind of approach. A little bit of hand-holding may be necessary at the beginning of the change, but as soon as they're more comfortable with the new system, then there's a possibility to decrease this particular component of the eHealth technology in precision. Okay. So again, the policy environment, specifically the governance side of things, should need to be addressed as soon as possible. And then there is definitely a need to shift to a hospital, more integrated kind of information system. What we recognize as a big gap when we go on the ground is that because they are the first, they're the primary health providers, many of the EMRs were actually directed to the rural health units. But then, at the end of the day, you need to consolidate, so you need more regional, more national kind of decision, and that's where the challenge is now. The consolidation information, because there is different systems that are being used on the ground. And before I forget, there's also the issue of contradicting policies. Because when you talk to the health workers on the ground, they will tell you they have this notion of interoperability. Like, for example, a patient that goes to one hospital, his or her data would be available to another unit, to another healthcare institution. But then, as we all know, the Philippine government subscribed to Data Privacy Act. Okay, privacy, data information, and when we all know when we're talking about illness, these information are very private. So there has to be some sort of a policy that would allow the health workers to navigate this discrepancy. So basically, that's what we found out so far. When we finish the study, we promise that we'll provide you with a more comprehensive, more exhaustive information. But I would like to also mention that as part of the ASEAN initiative, what we're learning now on the ground, although the situation may be a little different to the situation in Indonesia or maybe the situation in Thailand, what probably would cut across these different nation states would be the recognition that even if we're belonging to one country, there is the need to be more context specific because the challenges on the ground may be a little bit different. So the challenge is to come up with a regional governance framework, but at the same time is sensitive to the context and nuances, the physical infrastructure, the soft infrastructure that is emanating on the ground. Another thing is that as part of this project, and to be able to come up with a honest to goodness ASEAN regional framework, we will be collaborating not only for today, but there's going to be some sort of interactive activities and actual presentation workshops that we will be having not only in Indonesia, but also in Thailand within the year. And then, as part of this initiative also, we are publishing this monograph. This is just a draft copy, but we will be having it very soon. It's almost finished, except for certain copyright issues that we need to register, but it's almost done. So, in case you're interested, the Institute of Philippine Culture will be coming up with this monograph. So, I think basically that's it for the findings for now of the study. Thank you very much and have a good day.
So thank you very much, Dr. Lopez. So we will now be hearing the reactions from our partners in the Philippines. So first, we will be hearing from the Provincial Health Officer of the Pangasinan Provincial Health Office. Dr. Almoita, earned her master's degree in public health from the Virgen de la Rosa University Foundation and her Doctor of Medicine from the same university. So please welcome Dr. Cheryl M. Espinosa Almoita.
So, good morning, everyone, to all the participants in this conference. we recognize the importance of having good and quality data information in our healthcare delivery system. And we utilize data governance as an approach to managing data to allow our organization, our province, to collect data that is timely and secure information while also getting value from that information. At present, we are currently using the Field Health Service Information System, or FHSIS, to gather data information from the barangay health stations and rural health units. The FHSIS is the official and only information system of the Department of Health that is implemented to the barangay level, which provides data information on the different public health programs. But we have noted that there are certain issues that we are encountering using this system. For one is the late reporting or the late submission of reports to our office, and another is the inaccuracy and sometimes incomplete data that are submitted to the office. So to address this, we have implemented measures to ensure quality and timely data that are provided to the stakeholders. One, we have adopted an online reporting system, the Google Drive, that ensures the timely reporting of needed data from the rural health units to the district interlocal health zones and up to our office, the Provincial Health Office of Pangasinan. And as to the quality of our data, we have adopted the data quality check system that was introduced to us by USAID Health Gov in 2012. And the data quality check is the process that ensures the quality of this FHSIS data and information system in accordance with the FHSIS concepts, definitions, formula, and procedures in recording and reporting system. So it involves the review of our target client list by the rural health midwives and the public health nurses in the barangay health stations and rural health units. And using this what we call self-assessment tool developed for them to correct the recording and reporting system in terms of the following programs like family planning program, maternal and neonatal and child health programs, and other indicators. And now with the advancement of the technology, the DOH, along with other partners like the Ateneo, HATID, and the PhilHealth, have introduced the eHealth system to the province of Pangasinan, and currently we are using it in our hospitals and rural health units. And to further explain all about the eHealth system, I would like to introduce to you our eHealth focal person in the province of Pangasinan, Mr. Romel Cardinosa.
Thank you, Dr. Hello. Good morning to all participants. I would like to congratulate Dr. Leslie Lopez for coming out with the very comprehensive study and findings with regards to the eHealth system in the province of Pangasinan. I think the study is well said. The observations are all correct. I would like to add, however, that there's also finding on our part that should be added, I think, in the study, which I'd like to emphasize on the observations of sustainability. For example, the DOH EMR is not quite as observed in one of their findings, which state that some of their users observe that the DOH-CMR has no technical support or little technical support. This is because of the word sustainability I'm referring about, which also falls under the implementing guidelines of the DOH. So there you have it. Because of no sustainability, parang bitin. The project is does not have technical support in that sense, which make the end users hard for them to implement the EMR. So with that, thank you, Dr. Lopez, for Ma'am Leslie, for the well studied and very comprehensive findings as far as eHealth programs in the province is concerned. Dr. Shelo.
So thank you very much, Dr. Almoite and Mr. Romel. So now we would like to hear from our partners from the ASEAN region. So we'd like to call on Dr. Pramod Diwatakulmanit from the Chulalongkorn University to give his reaction.
Hello, everyone. Can you hear me well?
Yes, yes.
Oh, okay. Thank you so much. Sorry for the the bad connection for the network. Anyway, from Thailand, today I would like to share the project that my college is working on with the Bangkok Metropolitan. This project is called a mobile health application. I think it's related to the eHealth that we discussed today. So that's why I brought up this kind of project to show all of us. Okay. Actually, mobile health application is on the cell phone, as you know, and the component inside that I'm gonna tell you is the first one is the health information. The second one is health assessment. The last one is a health information and assessment among the aging population. To give you a picture of the application, actually the application is right here. I'm not sure that you can see this or not. With a heart shape, it's run on an Android program. And this one, for the health information feature, you can check out all the information. I mean, the user can check out all the information about the location of the healthcare services. For example, like a private hospital or the public hospital. Also, we also put information, some kind of the park or the restaurant inside as well, that all the user can find out the information and the contact number. So this part is one of the components in the mobile health application. And also the second one is about health assessment. You can see on your left hand side, it's gonna show you like a BMI and also the questionnaires that the user can fill out the form by themselves. And also the assessment from the questionnaire will give you the the suggestions or the recommendation. For example, if the user go on the straight questionnaire and fill out and answer the question, and then they will sum up with the score and also the recommendation for the user what they're supposed to do next. And we have a lot of the standardized questionnaire to put on this. And anyway, we also have the record book for the user to record about the health information as well, such as a weight, age, or maybe the illness. Okay. And the last one, we also have the feature for the aging population that combine a health information and assessment as well, that we're still working on. This one, we also focus not just only for the elderly, also the caregiver as well. That you can see, we got a picture of the elderly and also the caregivers. And also the elderly also can record the phone number and also some of the health information just in case there is an emergency that they would like to ask for help. So this kind of example that one of the projects that our college is working on. Anyway, but we still have the another project from the student that I think is also really good in the future, and I would like to share in the future as well. It's about the application to solve the problem of the obesity, because you know obesity is quite a big problem right now, and these students kind of develop the application and use the cartoons to make the user enjoy, take care of this cartoon. For example, like the cartoon. I'm not sure you know about the Pokemon or something. And then these students try to create like the Pokemon, and you need to take care of this Pokemon to feed the right healthy food, and also set the time to exercise, and you need to take care of the kind of this cartoon, and you also yourself need to like exercise as well to follow up this. I think it's quite a good idea that we can apply this in the future. But for the big pictures, like for the government, right now, I'm still not sure much, because right now the the kind of information and the government in Thailand is kind of change a lot, and I'm not sure the database that they gonna use and gonna uh, implement in the future. Still not sure. I'm still need to find out more information and maybe share the knowledge to all of you again. So thank you so much. If you have any questions, please feel free to ask me. Hello? Hello?
Thank you very much, Dr. Liwanag Gulmanit. So, for our audience members, please hold your questions for now. We will be noting we will have time for your questions during the open forum. So next up, we would like to hear a reaction from our representative from the ASEAN Secretariat in Jakarta. So we'd like to call on Ms. Intan Rindrastuhita to give her comment. Okay, so while waiting for Ms. Intan, we would take some questions from our audience. So both our online audience and our live audience, please feel free to leave your questions now. But we request that for documentation purposes, before you give your question, kindly state your name and your affiliation. Thank you. You may use the mics on the table, on your tables, to give your questions. Yes, ma'am.
I noticed one of the problems in the implementation of the eHealth was the infrastructure. And speaking from the engineering point of view, I guess one of the essentials that I think should or needs to be
claim electronically, you're not going to be reimbursed. There's EMRs that are regional health unit, but it's institutional level. It's not consolidated at a higher level, regional and even national. And basically, this absence of eHealth law is partially responsible why institutions, both public and private, are still groping on how to deal with these many forms of technology that are cascaded to them all at the same time. Sir, Phil.
We're hoping that it will be enacted, not yet a law. Yes, it will be enacted into law this year. And we're working with a whole technology, the technical working group of eHealth is working on the draft. It's draft bill that we are providing inputs for this development of the bill, and then of course to be ratified by the board houses of Congress. I have three things to say concerning the presentation of Dr. Leslie. The first is about the technical support. One difficulty of PayPal is providing technical support to all of these hospitals. We have about 6,000, but about 2,000 to 2,500 rural health units. So we have very limited manpower to cater to the requirements of these health facilities. So for us to be able to meet the requirements, we way back in 2013, 2014, we had this HATID project. It's Health Information Technology provider, in which we accredited about 6, and 7 is the Department of Health, for them to serve as the third party between eHealth and the health facilities. Okay? Because all that we have to do is just provide the API database, okay, and they can make use of whatever software they have, and provided that this software will meet the requirements, the specifications of eHealth. Okay, but that project was costly for the vendors. In fact, there was even a requirement for them to put up a data center. Okay, but because of the complaints, the clamor from the other sectors, so we're just doing now software certification. Okay, and instead of calling them GPs, we're now calling them so we're now doing our pixel report affordable to all of the players, okay, particularly the IT service providers. So these service providers will be the ones who provide technical support to the health facilities. So if there's a problem with the software being used by these health facilities, then there's a problem with this service provider. And we're now doing assessment of the performance of these service providers. If there's services that people give you or not, depending on the assessment of some sectors and even selected health facilities. And in fact, we are developing also a survey so that we will get feedback from the health facilities. And so that was the implementation. Why we had this third party between eHealth and health facilities. Okay. The second is about the technical report. There was this problem with the exchange of information between health facilities. Okay. In fact, that was the concept of establishing this Philippine Health Information Exchange, which is about information. Unfortunately, we were lagging in the implementation, not because of the problem with the participation of the board, it is but because of the funding. And then the resources that will be coming from, sorry to say, from the DICT. Previously from the DICT, but now on the Department of Information and Communication for this platform, the infrastructure to be provided for SIT. Dr. Dennis is a member of the eHealth Technical Working Group. So, but unfortunately, we don't have these resources. In fact, at present, it's the infrastructure of eHealth which is really this at present. So, that's the second. And then the third is about policies. Supposed to be is the eHealth Technical Working Group, and we have people on as the steering committee, but we have problem with the structuring within the office and the turnover of personnel. Okay, particularly working this office is unit under the implementation of this eHealth program. So we have a lot of challenges, but that's a nice opportunity to address. So hopefully with the implementation, or rather after the approval, the signing of the implementation, including those implementations for the Universal Healthcare Act, there will be some changes. Because the purpose of that will be the primary care. So it's Filipino will have supposed to have this called primary care doctor, okay, before escalating whatever issue that needs to be escalated to the next level of health facility. Okay, and that should be the scheme in the implementation of this primary care. I think that's all. Thank you.
Thank you so much for the very informative answer, but I would rather see it as both challenges and opportunities, because the UHC would provide probably the push, but how it's going to play out is something that we all need to wait for a while.
Okay, so we're still experiencing some technical difficulties, so we'd like to hear one more question or comment on any of the presentations that were presented today. So you can kindly raise your hand and from here. Please.
I'm Dr. Ricky Ventura from the Ateneo School of Medicine and Public Health. Based on experience, the field health has been moving and moving forms around. So the latest one is the CF4, which was implemented in March 1. Although initially it was supposed to be implemented last year, right, sir? Just a soft launch in March, and I understand the April one is the actual launch. I think it plays actually a very important role in your e-claims that you were discussing earlier, because even the doctors have to comply, you know? from a system where you said that they have to scan and then just send it digitally. Now we have to work on it manually. So I guess the role of digitizing it will also be different because for the person who will be at eHealth, recognizing the handwriting of the doctors, if they don't have a computer yet, before they send it out, that will also be a problem. So I guess the forms have to be, or the system has to be in such a way that everything across all, whether public or private, has to be uniform. And without that, actually the form is very basic for the doctors to fill out. But if those fields are not the ones that cut across both areas, then it becomes harder.
Okay, regulations, why we need to implement the use of CF4, claims for number 4. One is for portability, so that it will not create a big load on the infrastructure because it will just be simply PDF format of the charts, okay, and there's a need for a high bandwidth data set these charts to pick up. Okay, so that is one thing. So that's why we have to do it. We have to do it. Facilities need to do the coding. Okay, so one thing. And then the second thing is as we mentioned, standardization. So that it will be uniform across all health facilities, given this information being required by people. The third is why, sorry, I only one. The third is why we need this is to avoid these so-called articles, return to hospital. Because if there is a finding with the, for example, with the diagnosis, there's some thing which we cannot say correct in the diagnosis. It's because we have doctors and we perform this adjudication. So the health facilities are always advised to check again the documents. We return the documents to the health facility. That's why we call it RTS or RTS, return to center. So to avoid that, and then for the health facilities to reimburse a short period of time, because the RTS will take some time, 20 days and everything. So that's why we need to implement this. CF4.
I'd also like to add that in fairness to the field health, there is actually an app for doctors or for certain facility. It's on an Android, allowing you to be able to, like when I do my rounds and I need to discharge a patient, so that the diagnosis that doctor is saying, it's very easy, it's very quick. You have your diagnosis in mind and it's already there, and you can even put the code itself, which is actually a good innovation of field health to help the doctor.
I just want to ask Dr. Lopez in the context of my name is Dave Akilan, student. Since we're on the end of the healthcare and universal healthcare course for a province-wide and city-wide health system, the most important requirement of which is connecting the various facilities, whether they're public or private facilities, that way can really promote a city You can really promote a citywide or a province-wide system. My question is, in your travels and in the research that you conducted, is there a model now or a that has that when he or she is referred to the provincial hospital, the records are already there. Is there any system in place right now that we can kind of highlight and follow perhaps so that we can really promote a citywide or province-wide system?
I'm not familiar if there's, I'm not sure, no, but my observations are those cities and provinces that have their separate health insurance offices seems to be working towards those integration more than the cities and LGUs, which are implementing the health program purely as a health program. Example would be Cagayan de Oro. Cagayan de Oro City has a separate city health office and a city health insurance office. The city health insurance office actually deals with all the health insurance claims primarily with eHealth through Region 10 Pro, eHealth Regional Office, and manages the financial part and also the data part. So what they do is they actually optimize enrollment for eHealth. By doing that, they are actually capturing the data for most of the sponsored members, whether coming from CC, Conditional Cash Transfer, Federal Enrollment, Congressional, or NGO enrollment. So that makes them and then they make the claims primarily for the entire city, the public health side and the hospital side to eHealth. So by doing that again, they will have the information for the claims from the beneficiaries in that particular area. And 2 weeks ago, we were together. I was talking to the head of the City Health Insurance Office, and they have already proposed through the local health board a interoperable platform for the city to be able to link primarily the public side, but with the UHC, they will have to link to the private side and the public health programs and the hospital program. So they're, in a sense, this is one of the few cities that I've seen that are moving along and thinking along those lines. Around the Region 10, actually, there are several provinces with health insurance offices. I know Isami and Bukidnon having their own separate provincial health insurance offices, and I had not thought that seen their systems, but apparently they have similarities with the Cagayan de Oro City approach with regards to the health insurance system. So what we're saying is that it seems that the health insurance program or the benefits around it is serving as the trigger now to be able to make these systems interoperable. On the other hand, we were talking to Cabanatuan City and also to Pangasinan, and they're working on valid systems. And they're primarily just looking into the public health or the government side of things. So they're not actually sort of linking or getting information from the private side. The other concern that we are hearing from our LGU partners is how that special health fund will be uploaded, how they will receive it, how they will manage it. Some of them have been their citywide and province-wide plan already done, because that has been a requirement of the Department of Health for several years. And some of them, Pangasinan, for example, we've seen some of their province-wide plans. They've done that first quarter of this year for 2020. Some of the provinces have already finished that, but with the UHC, they will have to recalibrate, reconfigure those plans because those plans were done before the UHC era or the new UHC law era. So I think in response, because that interoperable scheme has to go through the national policy guidelines, the policy guidelines, but while that is still sort of evolving, we have seen some cities and provinces who are sort of approximating that through their own operation of their local health insurance offices in relation to their public health office and hospital management.
Thank you, Paul. So next up, we will be reading a comment from eHealth PH. So this is from Sir Edwin Manapat of the Cabanatuan City Health Office. So as mentioned earlier, they are actually one of the sites of the HATID ASEAN Project. So Sir Manapat says that the use of EMR within the facility is very efficient, as it is also required by the PhilHealth to submit for claims. But on the other hand, which is regarding the submission of reports through the FHSIS, it's still a challenge to the EB claimants because not all EMR providers have conformed with the FHSIS reporting format. So we're still taking questions for any of the presentations today. So we still have Dr. Ramon online. So if there are any questions regarding this presentation, please feel free to bring them up, whether online or here in our live audience. Yes,
this is a follow-up to Dr. Lopez talks about the need for the governance part of health. I hear that there is an eHealth bill that will hopefully become law in the next session. Does that bill respond to most of the challenges that you have identified when it comes to governance as far as eHealth is concerned? Is that what we're looking for the governance side?
Yes, there's actually, as was mentioned by Dr. Latano, there's a number of administrative orders. However, when we were on the ground, we were on the field, my sense is that they are not actually sure on how to interpret, for example, the rules and the policies that are emanating from the national office, particularly the PhilHealth. That's one. And then when I say governance, meaning maybe that's a start, but a good governance mechanism, the way I see it, should be sensitive to the particularities on the ground. So I recognize that there's a need for a national framework, but at the same time, a good governance system should also be sensitive to the nuances and then the particularities. So there has to be a space for that. So it's a wait and see attitude now, because the way I see it is that they have 6 months or 3 months to come up with the implementing rules and regulations. And I'm actually waiting for the few months because I wanted to see whether these nuances that I am talking about will be captured in the implementing rules and regulations. Because sometimes the situation in Manila at the national level is very ideal, very ambitious, and it's not capturing the actual challenges and issues that are present, emanating on the ground. So, yun po. Start po yun. Pero ang tingin ko po, I'm sorry, I should. Yeah, that's a start, but there has to be a space for that particularities, and big for that.
Dr. Lopez, are you participating right now in the crafting?
No, I'm not at the national level. I am more on the evaluation and the monitoring side of the eHealth technologies. I wish I am, but I am not. I'm sorry.
Important, because I mean, the implementing rules and regulations really detail the nuts and bolts of how these things will happen. And I think that the department itself will give all of the help needed to make sure that the experiences of life of people like who have done work in the ground are actually given to them as inputs. So that they don't, I mean, we always run the risk of implementing the regulations actually ineffective. So I think it's important that as we draft the IRR of the universal healthcare field, it hopefully listens to all of the inputs that we can provide from the ground so that it can be really translated into regulation.
I'm not part of the team that is crafting the IRR, but on the course of our doing field work, we're actually invited to the public hearing. So I'm waiting for that. So during the public hearing, we can actually make our opinion and these issues known to those who are able to make a difference. So I'm actually planning to attend the public hearing on the IRR. Thank you.
So thank you, Ms. Lino. But parang there are several things already happening with regards to the policy context, and also we just had the universal healthcare law signed a few weeks back. And what Bob was mentioning about the eHealth bill is another related policy issue which will be a law to look into this eHealth thing. And I think the main thing that they are proposing in that bill is the creation of a new entity, a tax agency inside the Department of Health and probably with health to manage the eHealth program, the national eHealth program of the country. Because as of now, there is no single entity that is looking into the eHealth issue of the country. What we need actually is an entity authorized by law to make the policies, to oversee the implementation of the programs, and to, in a sense, monitor and the data and the systems that are being implemented. So that's why I'm not sure what the other details are of the eHealth law of the eHealth bill contains. As far as the UHCIRR, we have received some invitations to discuss, and we're doing that initially informally, and hopefully that becomes a more formal interaction with the UHCIRR team. But from our side, we have planned to host several discussions, public discussions on the UHC, which we started last year, when the UHC was still a bill. And we plan to continue that through eHealth PH portal. So there's one scheduled on April 25, but this is part of a webinar with UP Medical Alumni Society. But we're following that up with a few more online discussions on the UHC bill. The idea is to have a platform that is open to the public in terms of the discussions on the UHC law. Whether that becomes part of the IRR implementation or not, at least the platform or opportunity to discuss it is open to the public through another platform. But we're also, like now, we're fortunate that Bob is here to be able to articulate more of the context of freedom. Hopefully, we'll have this type more of this type of discussions in the governments.
So thank you. Due to technical difficulties, our partners from the ASEAN Secretariat were not able to join today's via Skype call. So I'll just be reading out the message. So this message is from Alice Chong Singh, the head of the Science and Technology Division of the ASEAN Secretariat in Jakarta. So she says that this initiative is of great importance. As mentioned by the earlier speaker, this initiative received recognition to be a cooperation project under the ASEAN Committee on Science, Technology, and Innovation. As visible from the discussions, there are obvious importances and a number of difficulties. On the difficulties, the issues which could be proposed to seek additional support from ASEAN and dialogue partners would include interoperability, data security, and infrastructure. This will entail closer cooperation with the ASEAN officials who work on health, cyber security, and high-performance computing infrastructure. So we believe that this important initiative will need greater prominence to receive more resources in order to achieve the full impact. And the ASEAN Secretariat stands ready to support the facilitation of initiatives for greater impact. With this, we would like to express appreciation to each of you for your contribution in this important work. Thank you. So, are there any more questions or concerns that would like to be raised? Okay, so if there are none, so thank you for participating in our open forum in today's online conference. So please give our speakers and our reactors a round of applause. So it was really interesting to discuss eHealth in the Philippines and see the different overlaps and gaps in the implementation of such systems in the Philippines. So to synthesize our discussions for today and to read a message from Dr. Hannah Montoya from the PCHRD, I'd like to call on Dr. Enrique Nino Leviste, Associate Director for Research at the Institute of Philippine Culture.
Good morning. So first of all, I would like to thank this opportunity to be a part of this e-conference. I have been a participant in a series of e-conferences as well that have been spearheaded by the eHealth team of IPC. So my congratulations to Dr. Patan, to Dr. Lopez, and the rest of the team for these dynamic undertakings. So there are 4 themes which I wish to highlight, which have been repeatedly articulated in the conversation that we just had this morning. No? First is the importance of convergence and collaboration. Keep in mind that the context we are looking into, okay, the milieu that we are looking into, is working towards inclusive development through the passage of the Universal Healthcare Law. No? But of course, the passage of the law is just a chapter in this ongoing process of promoting inclusive development. So convergence and collaboration are important because such an undertaking was highlighted and presented, particularly by Dr. Lopez, is not necessarily a unilateral affair, but should necessarily be a multi-sectoral undertaking. Okay? What is the benefit of a multi-sectoral undertaking such as this? Through eHealth, okay, what is highlighted is the importance and the value of democratizing access to education and how this has ramifications, positive ramifications as far as health indicators are concerned. The second point that needs to be articulated here, and this was articulated repeatedly again during the presentations, is the importance of context. One has to recognize that there are diverse understandings, narratives, and experiences regarding the use of technology, particularly on the ground. In other words, there is a multiplicity of milieus out there that we have to be sensitive and mindful of. Okay. The third and more important point that needs to be raised here are the challenges that we continue to face as we implement reforms that are technology-based. No? It was highlighted again by Drs. Batangan and Lopez that a responsive and inclusive policy environment has to be in place, it has to flourish if we are to indeed experience change. No? If we indeed would be shall we say, if we would indeed pursue reforms that transform. So in other words, knowledge is empowering, but it can be enfeebling as well. So a challenge that also has to be faced, apart from ensuring that the policy environment is responsive and sensitive to diversity, is whether technology can indeed empower, or would technology such as this be an instrument to reinforce enduring inequalities, deeply entrenched disparities that have been existing for a long time. So questions which I thought need to be grappled with as we go along are, what constitutes a responsive and an inclusive policy environment? In other words, what needs to be in place? And secondly, in relation to the first question, in what ways does this policy environment help? Because as Dr. Lopez mentioned a while ago, she sees this as opportunities. And that's a valid point. But it's also important to point out in what ways does this policy environment hamper or hinder. So these are two questions that have to be continually grappled with and reflected on. So in closing, I would like once more to commend the eHATID team led by Drs. Bataan and Lopez, as well as our participants for today, for this vibrant and very important discussion on pressing health issues with regards to the use of technology in improving health indicators. Allow me as well to read a message from Dr. Jaime Montoya of the PCRHD of DOST. The Philippine Council for Health Research and Development, Department of Science and Technology, welcomes our participants and guests to this online conference entitled Health Systems and Service Delivery in the Philippines, Possibilities for a Seamless Regional Health Governance, which is part of the pre-conference activities of the DOST PCRHD 37th anniversary events. For this year's celebration, the DOST PCRHD team, Health Research and Industry 4.0, will tackle issues and opportunities that confront the health research landscape in the face of Industry 4.0. This online discussion provides us that opportunity as well as to use information technology to discuss with our partners here in the Philippines and in the ASEAN region. As part of DOST PCRHD ASEAN Project called HATID ASEAN for Accessing eHealth Technology's Contribution to Health Governance and Program Management in the ASEAN, this online discussion will serve to jumpstart the interactions among the ASEAN member states participating in the project, namely Indonesia, Thailand, and the Philippines. HATID ASEAN Project is currently being implemented by the Ateneo de Manila University Institute of Philippine Culture and forms part of the ASEAN Program of Action on Science, Technology, and Innovation of the Committee and Science Technology. A related ASEAN COST project, which the Philippines is implementing for the ASEAN Secretariat in Jakarta, Indonesia, is the Health Information Infrastructure and Governance on Incipient Technologies, HATID ASEAN Project, which we are also starting this month. We would like to recognize our HATID ASEAN country partners, namely Philippines through the Ateneo de Manila University Institute of Philippine Culture, Thailand through the College of Public Health Sciences, Chulalongkorn University, and Indonesia through National Institute of Health Research and Development, Ministry of Health. We have also invited the HATID ASEAN Project, our colleagues from Malaysia, through University Sans Malaysia in Penang, and Vietnam through the University of Social Sciences in Hanoi. We would like to thank the Ateneo de Manila University for the use of the Global Classroom, the LDD Convergent Technology Center, for this online conference. The use of ICT tools and platforms for social interaction and online conferencing is now considered an effective tool for connecting ASEAN member states in the ongoing process of ASEAN harmonization. The Philippines DOST PCRHD would like to contribute to this harmonization process by building these connectivities in the eHealth and health governance programs among the ASEAN member states. Thank you, and warmest greetings to our colleagues and partners from the Philippines and other ASEAN member states.
Thank you very much, Dr. Denise. So that ends the online conference on health systems and service delivery in the Philippines, possibilities for a seamless regional health governance framework. So thank you again to our speakers, our panel reactors, our audience, and everyone who made this event possible. So we wish you a good day. Thank you.
It's okay.